has mentioned diseases like diabetes and obesity disproportionately affecting African Americans. So to start our conversation, I asked her for her take on what he said.
What do you make of his comments?
Yeah, I mean, I have, of course, much respect for Dr. Fauci. And I think that his statements are accurate, that those conditions are more often seen in Black Americans than in white Americans. The one thing that I think needs a little clarification is that he almost makes it sound like that's happenstance. But actually, there's a lot of data that suggests that these conditions are a direct result of structural racism and other inequities in our society. So if you take, for example, high blood pressure, which we know people who have high blood pressure have worse outcomes if they get the coronavirus. We also know that people who are darker skinned in this country face racism and stereotypes pretty much daily. And there's data that suggests that facing those stereotypes and being aware of those as they go through their environment it causes enough stress to raise their blood pressure, which is what leads to hypertension or high blood pressure. So I think we have to acknowledge that there are disparities that pre-exist in our society that are due to economic and political and other reasons. And those are now being amplified in this context of scarcity and at this very challenging time.
Are there differences in the availability or access to treatment for coronavirus for African Americans versus the white population?
Yeah, I think there's a lot of data that shows us that that's the case as well. So again, I want to go back to pre-existing inequities in healthcare in this country. We know that actually people of color are less likely to have hospitals in their communities. They're less likely to have insurance coverage. When it comes to testing for the coronavirus, we obviously have a lack of tests. We don't have enough tests for everyone. And the criteria that were used initially to decide who got tested involved things like, did they travel to China or did they travel to Italy? And these are questions that would screen out a lot of people of color in this country. So automatically they were not able to get tests. A lot of the testing that's been done has been through private testing, which means people have to pay. And again, back to insurance status, and people of color tend not to have access to those types of resources. We also know that in the South, where a lot of people of color reside, many of those states chose not to do the Medicaid expansion with the Affordable Care Act. That left quite a lot of people under or uninsured in those states. So all of those factors together lead to less access for testing and ultimately treatment for people of color.
According to labor data, Black and Hispanic people are less likely to be able to work from home than white and Asian people. So are Black and Hispanic people, are they more vulnerable to the virus because they're more out in public possibly?
Yeah, I think that is another one of the factors that we're seeing. When you look at what are considered essential workers, that includes like transportation and people who work in grocery stores and serve society in a number of other ways. A lot of those people are likely to be people of color. And so it's very hard for them to social distance, right? We know what's working so far is social distancing. And if you can't social distance because your job requires that you interact with people, then for sure you're more likely to be exposed to the virus. The other thing to keep in mind is that we do have some other historical factors like housing discrimination, which have led to our current state, which is that people of color are more likely to live in multi-generational housing, which also means that increases their exposure to other people, even if they are staying at home.
Dr. Arghavan Salles, thank you so much for your time. I appreciate it.
Thank you.
As U.S. cities near their peak, the virus is just starting to spread into rural America. Hospitals in smaller towns aren't anywhere near well equipped to fight off the virus. Some areas may not even